My name is Jeremy Bray. I'm a professor of health economics at the University of North Carolina at Greensboro. I work in a variety of areas, but one in particular is alcohol screening and brief intervention. That's a process where a patient comes into a medical setting and fills out a short questionnaire, usually 10 items or less, on their alcohol use. And then based on what their alcohol use is, a physician will talk to them for a short amount of time to try and encourage them to drink within safe levels. Individuals who aren't drinking at all or drinking within safe levels may not be talked to at all. But patients who are drinking above safe levels but below diagnosable disorder levels will get a 2 to 15 minute brief intervention from the physician, encouraging them to cut back their drinking into safe levels. And patients who drink beyond that, who are at risk of a diagnosable alcohol disorder, are then referred on for further evaluation and possible treatment. I've been working on alcohol screening and brief intervention since the mid-1990s. One of my first projects was the Cutting Back Project in the United States, where we recruited 5 healthcare organizations to participate with us. In each organization contributed 3 healthcare clinics, which we randomized to one of 3 study conditions. One was business as usual. In one, the clinic performed screening and brief intervention where the physician did most, if not all, of the activities. And in a third, the clinics hired a specialist to come in and do the alcohol screening and brief intervention. And what we found was that as little as 2 minutes of brief advice from a physician or a specialist can get individuals to reduce their alcohol consumption to within safe levels. So it's a very effective approach to addressing the harms of alcohol use. We did find that it really didn't matter whether it was the physician or the specialist that provided the brief advice, that either way the patients tended to respond. So it can be a very cost-effective way of addressing the harms associated with alcohol use. Now, a lot of policymakers now will extend that to look for overall cost savings, thinking that reducing the alcohol consumption will get people to go to the hospital or healthcare less often. And we haven't found that necessarily to hold true. What we tend to see is people, after a brief intervention, might actually go to outpatient care more often. And that's consistent with a general wellness perspective, that they're paying more attention to their overall health and trying to take care of themselves. We do see some evidence of a reduction in emergency department use, which is also consistent with what the brief intervention is doing, because most of the alcohol-related harms in that risky use level are associated with accidents, and so getting people to reduce their alcohol use lowers their risk of accident, and we can see that in the emergency department. Overall, though, we haven't seen a total reduction in the cost of healthcare use, although that might still be possible. So while alcohol screening and brief intervention is most definitely an effective tool to combat the harms associated with alcohol use, we shouldn't necessarily expect it to save the healthcare system money overall.